start out with what came out on #1 on our list, which was to fight obesity.
It came up in the realm of prevention, and notice that prevention will appear, well, you can't notice it, but it will appear later on in the payment reform section. But the obesity component was so highly resonating with the group that it kind of rose as a point all by itself, because the estimates that are of unfunded liabilities that we have into the future, particularly for Medicare, for instance, of somewhere in the ballpark of $30 to $40 trillion over the next 50 years or so, does not include the impact of obesity.
Fighting obesity is like motherhood and apple pie. You know, we all love the idea that we can do something as simple as deal with obesity, make sure we're eating right and our kids are exercising, and we're going to avoid disease.
And the second one that came up on the list, again, I think we were all a little surprised at this, but it did, was tort reform. And Dan Vasella is going to explain.
The whole litigation issue around vaccines was a big deterrent for any pharmaceutical company to be in that field. And only when tort reform happened and when this was capped, what people could get, and it was made more difficult, that really this has changed and more players are now interested than they were before.
This litigation, or the threat of litigation, stifles the quality discussion because we're in an environment where we cannot as clearly discuss errors and address them in a high quality way.
Right. Well, and defining and measuring value is a kind of a, seems like a vague term, but the way we've defined it, we're actually going to come back to you two.
When we talk about what is the problem in the United States, what's the #1 problem with regard to health care, most people would say we're not getting what we paid for. It's real easy for people to say we're not getting what we're paying for, which implies you know what quality is. Somebody knows it somewhere. So why don't we begin to measure the elements of quality? And those elements are actually quite measurable. They're the outcomes that you desire, particularly around a particular disease. You can measure those. Matter of fact, we would propose that you might start with maybe the top 5 diseases in the country. Just focus. Those top 5 diseases probably account for roughly 60 to 70% of all the spending, especially in the Medicare environment. So begin just focusing on those, and we can define the outcomes we want for people after they've had their first myocardial infarction. We can define the outcomes we want for people who have diabetes, et cetera. You get the point. So you begin to measure the outcomes. Safety is another numerator element. Safety is easy. It should be zeros. The third is service, access for care, patient satisfaction, et cetera. These are all measurable, and you measure them in your business. So making it an effort to really measure, define and measure value. It's crucial because we're going to propose that you pay related to the outcomes of those measurements.
If we're going to spend money, let's invest on what's going to make a difference. The first place we have to invest in is prevention and wellness. People obviously would prefer not to go to a doctor at all. If they go, they'd rather go to prevent illness. Only as a last resort, go to surgery. We have a serious potential shortage of primary physicians in this country because of the way medicine has evolved into more specialty focused. We need to invest in creating more jobs and more incentives for primary care, be it from physicians, nurse practitioners, or others. And just to connect this to I heard the tail end of the last session, I think there's a relationship here. If we want to stimulate jobs in this country, one of our great opportunities and one of our great distinctions as a country is in the sciences, in medicine, in well-paying jobs. And we can actually strike a blow here for 2 of the things we're trying to accomplish. We can stimulate jobs in education and training, but focused on an area where we have a huge unmet need of primary care providers.
Healthcare reform is integral to our economy. If we postpone healthcare reform, broad-based reform now, the cost of inaction are going to be much greater than the cost that you addressed.